to have to start with, say, a thing called respiratory disease, because there's a bunch of very good professionals, absolutely committed, but they don't know to the nearest £10 million what we're spending, and they don't know whether they're spending twice as much or half as much as the respiratory people in the population down the road. But if we tell them what they're spending, ask them about the outcomes, and then introduce them to some other places for the different patterns. That's the job of the integrated care system. Now, maybe in practice it goes to the place-based partnership. But then again, if you're running an integrated care system and you've got 2 or 3 place-based partnership, you could start there, getting one and two. Think about what it's doing in comparison with another in the same population.
So if I take the respiratory example then, so it's I mean, as a clinician, as a medic, I'm very easily attracted to the comfort of medical model thinking. Yes. And, respiratory feels like a well-constrained, confined, sort of maybe even a pathway of care. But in the world we live in, patient who is more complex than just respiratory disease and more troubled by social determinants of healthcare and might be affected by other conditions typically, how do we break out of the medical model of respiratory to something about the consumer needs that are fundamentally different by a number of factors?